Thank you for returning from the fire drill. So our schedule is slightly modified. We're going to try to, we will continue to allocate the time for our panels, and we might just have you run and get your box lunches when we're done. My name is Evelyn Tomaszewski. I work at the National Association of Social Workers, and I'm a member of the Forum on Global Violence Prevention. I'm very excited to have the opportunity to facilitate or moderate this panel on social norms, violence, and lesbian, gay, bisexual, and transgender or LGBT youth. We have two presenters, and I'm just going to quickly introduce them. To my immediate left, we have Elliot Kennedy. He's a special expert for LGBT affairs in the Department of Health and Human Services of the Substance Abuse Mental Health Services Administration here in the United States. And to his immediate left, we have Richard Brzezinski, who's with UNAIDS since 2009 and is currently a senior advisor on rights, gender, prevention, and community mobilization. And of course, you can read their outstanding bios in some beautiful color piece of paper that was outside. You know, I don't want to take a lot of time, but it would be remiss of me not to to make a connection here to the work that we all do and that I do at NASW. But I think I look at the idea of heterosexism, heterosexism, and it's really the presumption that all others are heterosexual, or that opposite sex relationships are the norm and the only norm, and therefore superior. And this perspective, this belief, this approach results in a system of bias, attitudes, and discrimination. Whether one practices heterosexism, as we look at our own behaviors, we are in environments, communities, countries, places that have the roots of heterosexism, just as we understand that the roots of racism have a very profound and complex place and reality in communities, as does the effects and impact of heterosexism. This perceived superiority or majority lens, as I look at it, has resulted in youth and adults around the world, including in our own communities, to face inequality, discrimination, and violence because of who they love, their relationships, how they look, and for simply who they are. And I thought I might reread this statement so that we could each really feel that, because the idea of a superiority and a balance of power imbalance and a majority lens really results in youth, adults like myself, like us, facing inequality, discrimination, and violence because of who I love, because of my relationships, because of how I look, or because of who I am. And so this panel today is really going to, I think, for us, make the connection of something that might seem other to our work and to who we are. It's going to explore the findings both within a report published by SAMHSA and a newly released report from UNAIDS that addresses issues facing LGBT youth, both domestically and globally, and make some recommendations, solutions, and hopefully, as I sit down now, we'll also have time for some dialogue. So we'll begin with Elliot. And I'm told this clicker is very persnickety. Did somebody use that word earlier? So.
Good morning. I just want to apologize in advance. I'm still recovering from a cold, so hopefully I'm understandable at this point. Thank you, Evelyn, for that introduction. I think we have many similar thoughts on the context we're hoping to lend to this conversation. So, as Evelyn mentioned, I'm a special expert for LGBT affairs at SAMHSA, the Substance Abuse and Mental Health Services Administration. And in that capacity, I've had the privilege and the pleasure of overseeing the publication of our recent report on conversion therapy, which is mostly what I'm going to focus on today in my remarks. But I wanted to start by setting a little bit of the context for why we decided to publish that report, and specifically why we focus on LGBTQ youth issues at SAMHSA in general. So in preparing for the session, Evan and I were talking about the lived experiences of LGBTQ youth in the United States as a manifestation of the theme of this forum, which is really social norms that underlie the acceptance of violence. And so in the US, if you look at the disparities, particularly the health disparities from my perspective, but also just across a range of experiences, the disproportionately negative outcomes that we see for LGBTQ youth, it really points to a culture or an environment that not only is often not supportive of LGBTQ youth, but often actively contributes to harm. So we can look at the conversion therapy report as an upstream intervention, a sort of effort to mitigate disparities across a range of experiences by normalizing identities, providing accurate information about LGBTQ youth to hopefully intervene early at a point where many of them are exiting families and are entering systems that sort of begin or perpetuate trauma for the rest of their lives. So I just wanted to start by giving you an overview of some of the disparities that we see domestically. So LGBTQ youth in the United States face high rates of family rejection, victimization, and criminalization. They're disproportionately represented in child welfare and juvenile justice systems. Specifically, it's estimated that LGBTQ youth represent about 5 to 7% of the population, generally, but about 15% of the population in juvenile justice facilities. One statistic that I don't have is the high rates of sexual abuse and trafficking that these youths also experience. In schools, we see similar experiences. 63.8% of LGBTQ youth surveyed reported feeling unsafe in school because of their sexual orientation, 43.9% because of their gender expression. LGBTQ youth also represent up to 40% of the homeless population, homeless youth. And at least one study reported, my background prior to SAMHSA being suicide prevention, at least one study reported that up to 62% of homeless LGBTQ youth are likely to attempt suicide, as opposed to 29% of the general population. I think it's probably no surprise that all of these systemic barriers compound and drive health disparities. So as we're thinking about solutions to health disparities in particular, it's worth noting that all of these systemic barriers likely create new barriers to accessing services to care. Because particularly with respect to behavioral health, we know about the importance of establishing a trust relationship with a provider, which for a youth who has had that trust violated by every adult that was meant to have been trusting, it could be particularly difficult to establish a new relationship and get the care that they need. So back to the cultural competency, sort of back to the conversion therapy report, I think it's another example of how increasing the cultural competency of providers and giving accurate information to people is extraordinarily necessary to make sure that we can meet the unique needs of LGBTQ youth. So I mentioned suicidality in the homeless youth population. Among the general population, it's also increased risk. So lesbian, gay, and bisexual youth are up to 4 times more likely, and questioning youth up to 3 times more likely than their heterosexual counterparts to attempt suicide. And in one study, nearly half of young transgender people reported having seriously thought about taking their lives, and 1/4 reported having made a suicide attempt. Just from a behavioral health studies perspective, I will note that all the information that we have about suicidality for LGBTQ people is currently about attempts and reported attempts, because there's no postmortem way to reliably identify people. So one of the major challenges to doing LGBT work generally is the current lack of accurate data. So in thinking about some of our primary charges in addressing this issue for this population, making sure that we're counting so that we count is important. Something that's particularly relevant for the conversion therapy report that I want to highlight is the work of Dr. Caitlin Ryan at the Family Acceptance Project. If you're not familiar with her work, I highly recommend it. It's not only a model that has been employed domestically, but also she's done some work, particularly in China, with families who are struggling with the acceptance of LGBTQ youth. So family rejection actually correlates pretty significantly with a number of negative behavioral health outcomes in particular. So Compared with peers from families with no or low levels of family rejection, LGBT young adults who reported higher levels of family rejection during adolescence were 8.4 times more likely to report having attempted suicide, 5.9 times more likely to report high levels of depression, 3.4 times more likely to report illegal drug use, and 3.4 times more likely to report having engaged in unprotected sexual intercourse. So from our perspective, if we can, and from Caitlin's perspective, if we can work with families to reduce levels of rejection, we can intervene at a point where many youth are becoming engaged in juvenile justice systems, many youth are becoming ejected from homes and entering issues that are correlated with homelessness, and also family can often serve as a major support against experiences of mistreatment in schools. And one of the exciting things that I don't have on a slide here, but I just want to mention from Dr. Rand's research, is that Caitlin's work primarily focuses on helping families understand that whatever their deeply held beliefs or experiences around LGBTQ identities, what matters is the way that their children experience their behavior. And so one of the more interesting findings, I think, that she has discovered is that if you move from an extremely rejecting family to a moderately rejecting family, the negative outcomes are dramatically reduced. So even if we can move the needle a little bit, which I think is relevant for all families, to mitigate behavior, even if it's not changing beliefs, we can still change outcomes in such a way that LGBTQ youth can be protected. Last note on health disparities, I think the combined impact of all of these systemic barriers have a negative impact on health overall. So in general, the LGBT population experiences significant disparities in health indicators such as smoking, obesity, experiences of abuse and violence, behavioral health concerns, and HIV infection, among many others that I'm not going to list. So we're talking about a high-risk population, and one of the things that SAMHSA has done most recently that I'm going to move to talking about now is this report on ending conversion therapy. So I just want to start by saying the point of this report was, yes, to talk about conversion therapy, because it's been, national attention has increased significantly over the last year. In April, the administration issued the first ever statement against conversion therapy, highlighting the harms to LGBTQ youth in response to the death by suicide of a young transgender girl. And SAMHSA had already intended to publish a paper, sort of literature review that existed around conversion therapy, but decided it made sense to do a more robust response, to provide some meaningful resources for providers, for families, for people who are looking for information. And I just want to highlight that this is about conversion therapy insofar as we think about efforts to change people's sexual orientation, gender identity, or gender expression. So I think people classically think of sort of ex-gay camps or Exodus International. But it's also about sort of more nuanced things that are causing harm. So you're a provider, maybe you're LGBT accepting, maybe you're not. A family comes to you and says, we are struggling with our child's identity. We are struggling with our gender nonconforming 4-year-old. We think they might be transgender and we want to help them socially transition. There's a range of reactions that a provider can have, and some of them could be quite damaging, not because of malice, but because of a misunderstanding of the normative nature of LGBTQ identities. So this report is really meant to fill in those gaps, to give people the information that they need to understand how they can support and affirm LGBTQ youth. I also just like to mention it's a really good example of a public-private partnership in that SAMHSA certainly has the bully pulpit, for lack of a better word, to disseminate this information and to compile the information, but we are not the behavioral health experts in the field who are serving LGBTQ youth, developing the research that is giving us the best practices. So we worked with the American Psychological Association, and the APA pulled together a convening of experts around the country who met for 2 days to really suss out what are the questions that remain to be answered and where does the field sit on them right now. I think one of the more exciting, from my perspective as an openly transgender person in the government, one of the more exciting things about this convening was that questions about sexual orientation had, for the most part, been answered. questions about gender identity, not as much, nor gender expression. And I think they're relevant and they're interrelated in that when you're looking at children, often the first sign that parents are worried about their child may or may not be gay is gender nonconformity. So the report and the consensus statements that were developed by the APA convening for the first time address questions related to gender nonconformity, transgender children and youth, and newer questions that we're seeing across the country that are answered possibly not in the best form. On Oprah or in the news, we see parents who are socially transitioning their children, or questions about puberty suppressants, which is hormone blockers for youth. You can delay puberty and sort of give them additional time to decide how they want to proceed, which is a complicated question and not a question that people should be answering without the assistance of mental health professionals and primary care physicians. So I'll sort of walk through the breakdown of the report in a minute, but I do want to highlight that conversion therapy, as we typically think of it, is a problem, but also the problem of supporting and affirming LGBTQ youth from a behavioral health perspective is much broader, and that is really what I'm hoping people take away from this report. So I mentioned a number of these elements already. The consensus statements I'm hoping are not a factor of the report that get lost, in that it is groundbreaking work that was done by this convening at the American Psychological Association, and this report includes the first publication of those statements. We, after the consensus statements, have a significant section on research and clinical expertise, including resources and appropriate therapeutic approaches for mental health providers. And that sort of that was the framework on which the consensus statements could be made. We include areas of opportunity for future research, approaches to ending conversion therapy. SAMHSA, we've tried to depoliticize this as much as possible, but it is taking place. The report was published within a context of increased efforts domestically to ban conversion therapy through state legislation and through other efforts. So we do have what you could call a policy section. It is written from an ostensibly objective perspective of cataloging the existing efforts to end conversion therapy, and we take the position that it's never an appropriate mental health treatment, and the administration has publicly supported efforts to ban it. And then finally, recognizing that the first half of the report, the audience, I think, is always sort of a difficult thing to determine, particularly when we're talking about something that's happening within a context where providers don't have the information they need. Families are often the ones who are distressed by sexual orientation or gender identity, and they're driving sort of the issue. So determining what would be the best recipient for the information was a bit tricky. So we decided to split the report. I'm not sure how effective that was, but I look forward to your feedback on that. So the first half is really targeting providers, and the second half is sort of the top 10 key points across a range of topics that we are hoping people can take away. So there's a section for pediatricians on what we think about integrating behavioral health care and what we think pediatricians should know. There's a section for educators on mitigating distress in schools. There's a section specifically for trans youth on, affirming supportive behaviors for parents and families working with trans kids. So that's the report. Key findings. If you take nothing else away from this, this is what I hope that you know that we believe, and we are trying to spread this message. Variations in sexual orientation, gender identity, and gender expression are normal. Conversion therapy is not effective. It reinforces harmful gender stereotypes, and it is not an appropriate mental health treatment. This may or may not be of interest, but we were working on a very short timeline, and so I think one of the missing pieces of this work has been what next. So the administration made their statement in April. In July, the APA held this convening, which I should note did not have a predetermined outcome. So we were the APA, I'll leave them to describe their process, but deliberately convened a group of people across what you might consider a spectrum in terms of where they sat and how they felt about working with LGBTQ youth. And nevertheless, we ended with consensus statements that I think highlight the key findings in a resounding way, which is pretty incredible. And then October 15th, we published our report 2 weeks ago at a summit in Ogden, Utah. So one thing that is missing is the partnerships that we hope to develop with organizations to meaningfully disseminate this and to sort of travel around the country answering whatever questions might remain on this area. This is just a segment of the administration's statement on conversion therapy, which I should mention, I mentioned the catalyst for the statement, but the statement itself was a response to a petition on whitehouse.gov. You have to get over 100,000 signatures or something like that, and the White House has said they will respond to any petition that successfully meets that bar, and this one did. And the one part I want to highlight about this is just the second sentence there. The overwhelming scientific evidence demonstrates that conversion therapy, especially when it's practiced on young people, is neither medically nor ethically appropriate and can cause substantial harm. So that is true, but the compendium of information had not yet been packaged in a way that was accessible or meaningful to people. And so that, I think, in a concise way, really highlights the purpose behind SAMHSA publishing this report. Just a little bit more information about the APA Consensus Convening. I really do encourage you to read these statements in the report, which I am now realizing I did not include a link to in this presentation, but it's easy to access, and I'll tell you how. But they spent about half a day talking about sexual orientation and a day and a half talking about gender identity and expression, and came up with 17 pretty incredible consensus statements. Here are just a couple of them that I had not planned on reading, but just to give you a sense of the kinds of things that they came up with. Should I read these or let them be read? No. I'll just leave it. I did pick many of the ones that relate to gender identity. I'm slightly biased in that respect. So from left to right, this is the summit in Ogden, Utah. I was at my sister's wedding, so unable to be there for the publication. But at the left is Sam Ames with the National Center for Lesbian Rights. She's the campaign coordinator for their Born Perfect campaign, which is doing work to end conversion therapy across the country. To Sam's left is the executive director of Equality Utah. Next is Brian Altman, who's the director of policy innovation at SAMHSA, Dr. Caitlin Ryan, and then Dr. Judith Glassgold with the American Psychological Association. I did not want to end without at least addressing what, from our perspective, are the three primary methods that conversion therapy could be reduced in a systemic way. I do think that our focus is going to be transmission of information to people who are either distressed by sexual orientation or gender identity, or people who aren't but don't know how to respond when someone is. But systemically, there's sort of three main things. One is, and this is, I think, where the information comes into play, reducing discrimination and negative social attitudes towards LGBT identities and individuals. And I think this is the primary way that this fits into this forum, and the primary thing that I think we could take away, that any work we can do to normalize LGBT identities reduces negative outcomes for them. And it's often a question of life and death. Second, dissemination of information, training, and education for behavioral health providers, which I think we've discussed. And then legislative, regulatory, and legal efforts. And among here, I mean, there's more detail within the report, but this also includes things like behavioral health associations interpreting their ethical guidelines to say, you know, this is not ever an appropriate behavior. And I should note, I think part of the reason these consensus statements hadn't been previously developed is that every major behavioral health association already had a statement against conversion therapy. So on the one hand, there are people who say, how can we possibly still be talking about this? And on the other hand, there are so many people still experiencing it in some way, shape, or form that there's a missing gap between communities, or a missing link between communities. So in terms of what's next for us, we would like to develop, it's a large report, you know, it's not something that I imagine everyone will read in its entirety, but it's missing things like youth-specific resources or, you know, easy handouts that can be accessed in providers' offices. So I would like to develop those. We are doing several trainings and webinars and conference presentations, and if you can think of other ways that SAMHSA could partner to either talk about conversion therapy or affirming approaches to supporting LGBTQ youth, or generally improve the experiences and outcomes for LGBTQ youth, I'm certainly interested in hearing about it. I just wanted to end by saying in the report there are 4 quotes, which are the only places where voices of survivors are directly represented. And I just encourage you to take a look and learn a bit about their experiences. So, thank you.